kind of briefly showed in the last video. What we can see here, the stomach's been removed so that we can see the pancreas. The pancreas sits a little posterior and then off laterally of the stomach, kind of off to the left. The spleen will sit, like I said, on the left side of the body. Remember now, once we're inside the cavity, we are not going to be symmetrical. And when we're talking about sides, it's always the side of your patient. Okay, so if you're looking at the model, okay, it's not your right side, it's your patient's right side. Okay, so it would be my left, my right. Okay? So spleen is over here on the left side. The pancreas, the head of the pancreas will actually butt up into that first curve of the duodenum. This is so that main pancreatic duct can drop its insulin, glucagon, things like that, and combine with the common bile duct into this little structure called the hepatopancreatico-duodenal ampulla. Let's say that 5 times fast. Okay. Some books will call it the hepatopancreatic ampulla. I think there's a couple of other names for it. Okay, remember in anatomy, if there's one name for something, there's 7 other names. So whatever term that you decide on is fine. What we'll also see here is, remember, the kidneys are going to be sitting posterior. Okay, these will sit what's called retroperitoneally. Okay, I think I just added the ly, but they will sit in the retroperitoneal cavity. Okay, right up against the muscles of the back. So they are actually sitting outside of the peritoneal cavity. Okay? So they'll actually have fascia on their front sides. So this will loop around, this will be the duodenum, then we would jump into or begin the first structures of the jejunum and then go into the ileum. What we can see then here is our gallbladder. The gallbladder, all it is a fancy sac for holding bile. It does not produce anything. The liver produces bile, and then it will be transported and stored within the gallbladder. So coming off of the gallbladder, we're going to have the cystic duct. Okay. Coming off of the liver, we'll have the right over here and left hepatic ducts, which they come together to form the common bile duct. Common bile and the cystic duct come together to, the common hepatic duct and the cystic duct come together to form the common bile duct, which will then join together with the main pancreatic duct to then drop their contents into the duodenum. Okay. Those are signaled to be released upon the first entrance of food, if you will. So as soon as we eat something, or normally, sometimes actually, as soon as we smell something, the body will start releasing those compounds to prep for digestion. Okay. And then what we can see here on the back side, this would be, at this point, our abdominal aorta, along with our inferior vena cava. Okay, these are going to be our major sources of blood supply going away from the body. Or away from the heart. This is going back to the heart. What we can also see is this would be our first branch off of the aorta. This is called our celiac trunk. Okay? And we have a couple of branches coming off of that. This would be our common hepatic artery here. So common, meaning it's going to split again. Hepatic refers to liver. So that's going to give us the blood supply to the liver. This would be our left gastric artery, gastric meaning stomach. And then back here, we'll have our splenic artery, which is going to go to supply the spleen. So like I said, the head of the pancreas is going to butt up into that curve of the duodenum. We have the body of the pancreas and then the tail of the pancreas. I've always been taught that the tail of the pancreas tickles the spleen, if you want to remember it like that. And then also sitting on top of the kidneys, 2 structures that we see here, these are going to be our adrenal glands. These are responsible for supplying our fight or flight hormones, epinephrine and norepinephrine, or adrenaline and noradrenaline, in the instance of us being stressed or scared or things like that.